Just to move to Dr. Kaakeh, and I know this is what she likes to talk and educate us about. The issue of supply chain to acquire therapy and PPE has been a challenge. And what's your experience in Chicago and at the national level? Are we ready for any potential surge?
So I've actually been focused on the global pharmaceutical supply chain now for over a decade. I lead a healthcare consultancy called Salus Vitae Group, and over the past several months, kind of early on in the pandemic, we've offered various resources on tackling low medication supplies amidst the pandemic. So that's available on our website. But to bring it into kind of context, we always talk about the COVID world right now, the world that we live in, and pre-COVID. So back in 2010, which what we consider the peak of the drug shortage crisis here in the United States, my colleagues and I, we actually published a research article that highlights the impact of drug shortages on US health systems. So it really shed light on the drug shortage crisis, and it quantified the personnel resources required to manage a drug shortage. That being said, pre-COVID, we experienced in the United States and globally hundreds of medications that were on shortage. So the concept of a drug shortage is not new. And I think drug shortages in general have existed ever since drugs were manufactured and made. But what I've learned over the years is that the issue is twofold. Is the supply chain ready? And are we ready for a vaccine or a medication? So the first question actually gets at, can the supply chain handle it? And then the second gets at, can we as individuals or institutions handle the vaccine? That means, are we able to manufacture and distribute the vaccine? Because even if it gets approved today, are we able to get it? How are we distributing it? And so do we have the resources we need for the vaccination distribution and administration process? Now, what the COVID-19 pandemic has demonstrated that we are not ready for such a surge in demand, but we are preparing. So it's highlighted that we must all truly understand the pharmaceutical supply chain in order to prepare. If you think about it, no time in history has everyone continuously talked about the pharmacy supply chain as we await the vaccine and potential treatments. But if you keep in mind, any disruption in the supply chain can actually lead to a drug shortage. Now, pre-COVID, so again, I was talking about this pre-COVID and COVID worlds, we were experiencing hundreds of drug shortages in the United States. The latest numbers, according to ASHP, which were last updated the end of September, there were 98 new drug shortages in 2020 thus far, and 265 active drug shortages. So these are drug shortages that health systems and professionals on the front line are having to deal with. Now, pre-COVID, if you walked into the emergency room, there was a survey that was conducted that almost 90% of ER physicians said that they reported not having the critical medications they needed to treat their urgent patients. So then now comes COVID, right? And so during COVID, shortages and potential shortages actually have been due to a spike in demand, and not the other most commonly reported reasons for shortages pre-COVID, which were manufacturing and quality issues. So that spike in demand really caused the concern for drug shortages. But if we think about our supply chains in general pre-COVID, as we think to what we're preparing for now, we weren't providing equitable access to all the medications needed globally before the pandemic. Because data from the World Health Organization actually stated that 2 billion people lacked access to essential medications. Now, if we just look at the pharmacy supply chain in general, and I think this speaks to many of the conversations we've had thus far in the conference in terms of not operating in silo and that we are truly dependent on each other, and that the fact that the pharmacy supply chain is very global, it's very complex, and it's very sensitive to disruptions worldwide. So there are truly ripple effects because there are several flaws embedded in that complexity. And already we know our healthcare environments are very vulnerable and very fragmented. If you look at the supply chain in general, regardless of what country you are in, we depend significantly on both India and China for our active pharmaceutical ingredients and finished medications. Just here in the United States, the FDA reported over 80% of our active ingredients and 40% of our finished medications come from sources outside of the United States. Yeah. So really the supply chain isn't designed to meet the potential surge because there's so much sensitivity. And even if you think about the supply chain, we're so focused right now on COVID-related vaccines or medications, but the supply chains actually have to be suited to meet both current and future needs. So that means pharmaceutical companies have to ensure a continuity of care of their existing supply chains so that patients that need medications are able to receive them. But then when you introduce new medications and vaccines, companies now need to either create new production lines or they potentially repurpose production lines. And that's a significant amount of work and resources. So just looking at the sheer amount of resources and time that takes. But if we go back to COVID, the COVID-19 surge isn't your normal surge because of the number of resources and time that's actually devoted to ensuring and building the necessary elements of the supply chain. It's very different than other scenarios. We've had shortages before of essential medications, and it didn't receive the attention that it did in this case. And so we've often talked about a vaccine. Different countries have called it a global public good. So how we position, how we talk about it is different. But with this question, I always like to reshift it and actually ask, instead of are we ready, is how will we prepare? And I think many of our panelists and speakers as far have also talked about the need for preparedness. So that means it shifts our conversation to asking how are we reacting to changes in information and practices pertaining to the pharmacy supply chain. And then we get into the conversations about who gets it. And one of the biggest challenges we're going to face is in the distribution of the vaccine and any treatments, whatever they may be. So we have to consider,
Yeah, I hear you. Absolutely. It is who would get it and to prioritize who would get it first. I know I have only 5 minutes left, but I would like to hear probably start with Rola. 2 minutes or 1 minute about the vaccine, each one from you. Where are we going? What would you tell our audience? So start, Rola, what would you tell us about the vaccine?
Of course, I'm actually going to just build a little bit onto what's already been said in terms of, there are several in clinical trials right now, various stages of the phases within the clinical trials, many preclinical. And then I think we've reiterated this throughout the panel discussion in terms of really truly being prepared. But I think what's very important, and as kind of a take home in terms of the pharmaceutical supply chain, it is very, very diverse in terms of the number of stakeholders, the types of stakeholders. So truly in whatever position you are in, you are part of the pharmaceutical supply chain in one way or another. So you truly do have a role in terms of ensuring and helping ensure access of these vaccines and these treatments in the immediate future and really to any medication. So really evaluate and determine where you want to focus your energies and take responsibility, at least the bare minimum in terms of the information that's being generated and the transparency across the supply chain. That will be of great benefit to help drive better policies. It'll help better train those that are at the front lines that are quickly responding. So we not only have a responsibility, an individual responsibility for those who we serve, but especially in this case, we have a collective responsibility to really ensure access to the medications that we have. We are highly dependent on each other. And so one of the most important pillars here is to look at equitable access. So as we design our processes and look at it from each step of the way of how the vaccine moves throughout the supply chain and how we deliver it to our patients, you need to look at it from a lens of equitable access as well and prioritize. We have to make the hard decisions about who gets it first. And I do definitely recommend that you talk to your pharmacy colleagues. We have been managing drug shortages for so long. We've gone to we've gone to work and gotten the phone call where there's no longer that medication available and had to adjust quickly. They have put processes in place to accommodate that. Work with them. If some reputable institutions and wonderful institutions across the board, no matter how big or small, have created these policies. So I definitely recommend that. But again, keep the equity in mind, design for equity, and be intentional about that.
Thank you. Thank you, Rola. Dr.